Thanks very much, Christine. Good morning, everyone. Welcome to Leeds. I live in Leeds. I work at the venerable institution just up the road as a children's consultant. It shares an anniversary with the NHS. The infirmary is 150 years old in May. Of course, the NHS is 70 years old in July, and we want it to go on for many, many more years, which is what this demonstration is really about. I just want to say something about public health from a paediatric point of view. As I said, I look after children at work, and this country now has worsening statistics in relation to child health, perhaps the first time for many years, and this is an indication, I think, of how austerity politics is really undermining people's health. Compared with 10 European countries, Canada, Australia, New Zealand, we're fourth at the bottom in terms of mortality rates, death rates in children. And infant mortality now in this country, according to the Office of National Statistics, is actually going up, which is a terrible thing. Another terrible statistic is that if you live in a poor and deprived area, infant mortality is twice as high as if you live in a rich area. And this underlines how much social inequality determines people's health, not only their survival at birth, but their long-term survival and risk of having illness and disease. And strikingly, 20% of children now in the UK live in poverty, and this is actually getting worse, again according to data from the Office of National Statistics. We know that other indicators are getting worse. Immunisation rates are going down. Breastfeeding, only 1/3 of children breastfed. That's one of the worst records of any country, which is pretty appalling. All these things, I think, reflect austerity, cuts, underfunding. And when we think about what's being done to the health service, we also have to remember that part of the health service is public health, which is being undermined, but is absolutely crucial to population health and keeping us all well in the future. So this legal challenge today, as you all are aware, is extremely important. It's fantastic to see so many people standing up for the NHS. And as someone who works in the hospital up the road, I hope I'm here and able to say that I'm representing many, many of the people in the infirmary who may not be here standing with us today, but are here, I think, in spirit while they're working away, looking after people in the hospital. Thank you very much.
Thank you very much, John. It's always good to have a consultant because they see the other side.